hosting these along with our members, which include the Clean Foundation based in Nigeria, which is also our secretariat. Other partners include the ICJK. I can see Julie here. That's the International Commission for Jurists, the Kenya chapter. We also have APCOF, which is the African Policing Civilian Oversight Forum, located in South Africa, and the Tata Institute of Social Sciences, India. We are a South-South alliance, and we collaborate among our various partners that include NGOs, civil society bodies, universities, and research institutes to promote safety, public safety, and justice in our regions, keeping in mind the international human rights. We've had, this is our 8th webinar week on COVID rights. And initially, we started with the idea of just sharing what's happening in our countries, how COVID is impacting the common people in our countries. And now we have moved forward to have more of a share, from a sharing to more an analysis and also an intervention of how we could strengthen justice. I'd also like to remind all our participants that we are not just a civil society forum, but we work together along with the state institutions that include not only the police, the civil, justice organizations, but also administration, the legislature, and of course, we have our civil society partners and practitioners along with whom we work to bring about change. So it's not just a matter of sharing and exploring, but we also co-create innovative strategies which can strengthen the delivery of justice. This particular session is rather important because we are going to be diving a little bit deeper, and we're seeing, especially given the times where we find that injustices are getting repeated sporadically, but very repetitively. I think everybody will agree with me that George Floyd has now symbolized the inequalities which we see on the political, the social, and the economic fronts. But it's not just the blatant and the brutal inequalities or the violence which we are seeing around the world. And even in Nigeria and Kenya, we saw that so many people in the initial stages, more people would die from police firing than from COVID-related deaths. But also, I think we're going to be diving deep to see that how there's a denial of opportunity to survive, to live. With this lockdown, we are finding that people, the common people, the poor, who are hawkers, who are vendors, who have not been allowed the right to go and earn even the meager amounts they did for their livelihood and to sustain their families. So we are going to dive in deep and see with our panelists, which is actually an eclectic mix from human rights activists, practitioners, and intellectuals. And we'll see how the policy is not just a matter of policy and programs and institutions where there's a gap in delivery of justice, but how they themselves could be unequal. What are the ideas, the values, and the purposes where we find that inequalities get institutionalized, they are codified into law. So you have petty crime, which is a big affront, and you have jails which are full of people who are in jail for crimes against petty theft. But the economic offenses, people having taken huge amounts of money and corruption, those people are scot-free. So what is in our governance structures, in our systems, where we find the inequalities are built in and these are repeated? So we're going to look forward to our panel and see how they'll tell us how these can be called out and what kind of intervention and alternatives we can create. Before I pass on the space to Madhu, I just wanted to remind all ourselves that we all follow the very basic norms of virtual discussion, which is we all keep our audios on mute, unless we're speaking, of course. So everybody has to have audios on mute, but please do keep your video on. We do want a visual exchange and interaction. And I'd also invite you all to start using the chat box, not just for questions or observations, but also to raise your concerns and any kind of comments that you have, because that's going to make our sharing more productive and more wholesome, and we'll get an idea of what's happening in different parts of the world. Madhu, I'd like to now invite you to take over. Let me just inform all our participants that Madhu wears many hats. She's not only the chair of the International Relations Office in Tata Institute, but she's also the dean of the Vocational Studies School in Tata Institute. And moreover, her specialization is where she's a professor in the Center for Study for Exclusion and Social Inclusive Policies. And her specialization, her concerns are on inequality and the politics of development and how that plays out through the institutional structures and governance delivery systems. So Madhu, over to you. She's going to moderate and do the honors of inviting all the panelists.
Thank you. Thank you very much, Renuka, for your kind words and for the introduction. It's my pleasure to be part of this very important discussion forum that has been put together by AAAJD to discuss how policies and institutions for public service delivery, including social security provisioning for the vulnerable, is actually getting played out in these difficult times that we are having. What are the strategies? How are the vulnerables having spaces, and what type of voices are being heard and what doesn't get heard? We have with us, as part of this discussion that we are looking at, we have got some issues have been already identified, what we want to talk about. We are going to have in this panel the experts who will talk to us and give us an idea about what are the experiences and the lessons they have from their experiences regarding welfare provisioning and public service delivery, what type of debates and challenges that are there in this forum in this space with reference to access and delivery of social security programs, and also share with us some of the alternative strategies that are and mechanisms that can be there or are being worked out to reach out to the vulnerable so that they get a fair share in these discussions that we are exploring and understanding the processes of reaching welfare to these vulnerable populations. And before I get into invite my panelists to start talking on this, I just needed to bring in a few concerns that we are looking at when we're talking about inclusive development in these difficult days and COVID, because as we said, the health or COVID it doesn't see anybody. It's a health issue. But what happens is when its impact is most felt among those who have the least voice. And that's where we want to see is how does the system, how do we as people, how do the society as a collective connects and makes these voices that are least heard come into the frame, and so that they can become the part of the development that we need to think about when we are talking about COVID and the post-COVID scenarios when we are looking at development, when we start talking. In this scenario, what we want to look at is how, for example, our low attainment educational attainment is looking at creating conditions or magnifying the conditions of vulnerability and social exclusions, and doesn't create challenges to inclusive development, low education attainment. We also can discuss about how does the expanding informal work and lack of social security coverage among the poor, particularly as we have seen in India and the world has seen, is the migrants who have been caught in this pandemic. How are they being heard, and what are the policies and strategies that could be coming into space to get them heard? We need to understand is in all our discussion is the voice and what strategy, both in terms of identifying and understanding who these vulnerable are and who gets most impacted by this pandemic, and also identifying and understanding the different types of distributional and operational strategies that are mechanisms that are there, which all the governments across the world are thinking about to address the vulnerable. Are these strategies vulnerable strategies and mechanisms? Do they provide a voice for those people who have no voice? Are they just systems which are being put up just to address a particular situation and not concerned what the specific needs of the different people who are part and who are experiencing this this pandemic. So these are some concerns that we have to talk about when we are thinking about vulnerable. Vulnerability is not only an identity that creates a condition that is socially or socially constructed, but also vulnerability in terms of the disadvantages that come from disengagement in the political and lack of economic position and education, which creates which aggravates the deprivations that the already poor and the excluded experience in this process. So these are some concerns which I thought would come into space. And when we are talking about how do we think about inclusive strategies for those who are vulnerable, I would like to bring to your attention is that we normally have two broad lenses through which we can look at these inclusive processes. One could be the social interactions or the collective, the group interactions that are happening, the social interactions, and second, social and economic, social interactions, which is linked to economic positions and the access to education, legal systems, all those things that are, but also more importantly, the space that is provided in terms of engagements, which is engaging in decision making, engagement in participation, engagement in political spaces. So these are some of the strategies which could become important if we are going to talk about vulnerability. Today, if we are talking about Floyd, what has happened with Floyd is the lack of voice that the people had in the system. And that's what we are seeing today is we need to bring about is understand how the voiceless can be heard, how the voices can be brought. So with these few words, I would just like to say that we have with us 5 panel members who will discuss the different lenses they bring from their expertises. And I would request each panel member to keep to the time of 7 minutes so that we are within our space, we can work. I would like to request, first I will start with those who are active in the field, who are real active. So I would start with my our colleagues from Africa, and then move into the academy, those who are intellectuals and academics working. So I'll stick to last with the academics and experiences from research. And so I will start with, I would like to request Miss Ruth Gatobi to come in and speak. Just as an introduction, Ruth Gatobi is the regional coordinator of the Kenyan National Commission on Human Rights. So we are very honored and happy that Ms. Ruth could come in and share her experiences with us. And then I will introduce the other panelists as we move, and as I request them to come on to speak. Thank you. Ruth. You are muted.
Hi, Ruth. Can you please unmute yourself? We can't hear you.
Can you now hear me?
Yes, we can hear you. Thank you.
Okay, thank you very much. First and foremost, I want to thank you all for giving me this opportunity to share with you in this particular platform. I have to begin by noting that COVID-19 pandemic hit Kenya at a time when Kenya was going through various issues. First and foremost, Kenya had an invasion of locusts, which had an impact and still continuing to see an impact in agricultural activities, and therefore food production is going to be affected. Also, the pandemic hit at a time when Kenya was also facing the challenges of floods and mudslides, henceforth leading to loss of lives and displacing people, and therefore the challenges that come out of displacements. People have to relocate to safer grounds, and therefore issues of social distancing as recommended are not there. And also, Kenya was also facing a lot of insecurity. We've had in several parts of this country where insecurity is quite high. And these are issues that led to violation of various rights, right to security, right to safe housing, for instance, the evictions and displacements, and right to food, which means that most of these categories of people who have been affected by these other issues, who may not necessarily be in the category of social welfare programs, still need to be supported in one way or the other. However, I also have to note that the most vulnerable people in this country rely on public services, be it health, be it education, be it transportation. So the complications that come with COVID-19 and the various government measures put in place to contain the spread of the pandemic, of the virus, I mean, then have a very heavy bearing on the most vulnerable people in society. However, the government has put up measures to cushion the vulnerable, to cushion various people from the negative impact of COVID-19. Some of the fiscal measures that the government put in place include reduction of pay from 30% to 25%, and waiving pay for persons earning below 24,000 Kenya shillings, and also reduction of VAT from 16 to 14%. And these are some of the measures that were aimed at cushioning people from the devastating effects of the pandemic. However, we have to note that not all vulnerable people fall in this category. Majority of the most vulnerable people who live in informal settlements and in remote, far-flung areas in this country are not actually employed, and therefore they live on a day-to-day casual jobs which have been affected because movement has been restricted. The government has even zoned various devolved units, county governments that are hotspots, and restricted movement into and out of those counties. And even within the counties at the local level, we have had issues whereby mapping of people who should be reached out with cushioning of relief packages was not sufficient. We have people living in far-flung areas who have not been reached out, or those who live in border, inter-county borders, who have to struggle securing this help from this county, yet they are told, no, you're supposed to get this help from the other county. And therefore, even the Ministry of Labor and Social Protection, yes, we do have social security services and cash transfer programs aimed at orphans and vulnerable children, elderly persons, and also the poor in the urban settlements. However, this has been revamped. The government has increased some of the allocation to go into cash transfers. However, I also have to note that these measures are not sufficient because the restrictions that have been put in place by the government have brought out some of the disparities. For instance, the enforcement of the curfew means that the caregivers are afraid to get out of their homes at night to take these sick people to the hospital. And even the restriction of movement into and out of some counties have led to food shortages, and therefore, even if these people are given cash transfers, then it means that affordability of the food, because the food, when the supply is short, it means that the cost goes high. And even the fact that caregivers have to move physically to go and collect the money in designated banks or M-Pesa, which are agents, it means that there is the cost of transportation. And the fact that transport is being regulated, public transport is being regulated to reduce the number of people that are in one vehicle at a time, then we have seen an increase in the cost of transport. So you find that people have to move physically long distances, and having infrastructural challenges of transportation. The cost of transport then eats into the package or the cash that these particular vulnerable people have been given. On the other hand, I also have to note that because of the indefinite closure of schools, when Kenya first recorded its first case of COVID-19 patient, we have seen disproportionate disparities in terms of access to basic education. For instance, the government has advocated for virtual learning, but which includes people must have a phone, you must have access to radio or television. There is also need to get in contact with the schools of the pupils, of the learners, and this requires you to go out of your way to even print some of the materials. However, I have to note that the most vulnerable, those who live in informal settlements and those who live in far-flung areas, have no access to such particular services. And therefore, we have seen an instance where those who are poor cannot actually access their right to education.
More? So
Sorry?
We have 1 minute with you, so we
Yes.
then move to the next. Yeah. Yeah.
Okay. Okay. And so, therefore, we have also experienced a lot of layoffs. The Kenya National Bureau of Statistics has given us that statistics that a majority of people have suffered job losses or being forced to take unpaid leave. Yet the social security protection measures tend to lean towards those only who are employed, or the vulnerable, or the old, or the orphans and vulnerable children. Then what happens to this category of people who have suddenly lost jobs, who are suddenly being evicted from their homes, who have suddenly lost revenue, especially those in the rural homes, depending on their relatives in urban centers to send some of the cash stipends for use at home, and yet in urban centers, job losses are very common. So we have had this particular group of people who are not catered for in the cash transfer system, and yet they are in dire need of the social protection by the government. So it's a tricky balancing act. Yes, you have to balance in ensuring that people have access to education, yet we have children who have been relying on school feeding programs and immunization. And when you put a stop to access going to school, it means we have these children now who are at home, they lack food, some are not even accessing immunization. Our Ministry of Health has recorded a dire a situation where people are scared of going to the hospital because they think they could contract coronavirus at the hospital. So basic medical treatment is not being accessed by fear, first of all, because of the virus, and also the fact that people are not able to access health provisions because it's quite expensive, and all the government attention now is being put towards COVID-19.
Yeah, I think. Thank you very much, Madam Ruth. That was some very important points brought out. I'd like to request Mr. Jake Epal to come and speak. Mr. Jake Epal is the founder and chief executive officer of the Albino Foundation. He has worked, I think, are we there? Is he there on the?
Yes, he's there. Madhu, he's there. Yeah.
Yes, I am.
Okay, thank you. I just wanted to briefly introduce you, Mr. Jig. Wonderful to meet you over the webinar, and really happy to have you with us. Just as a brief introduction to the group here, listen to Professor Mr. Jake is the founder and the chief executive officer of the Albino Foundation. He has worked extensively on the plight of the people with albino through his work in journalism, broadcasting, advertising, and public relations. Thank you very much, Mr. Jake, for being here with us. And you have before you 7 minutes to speak. Thank you.
Thank you very much. I want to use this opportunity to thank Clean Foundation for recommending me and inviting me, and this great institution for also agreeing to invite me. I am particularly grateful to Dr. Benson and his team in Nigeria, and I want to say that they are doing a great job. With that said, let me begin by tweaking our imagination and bringing you in reminiscence to the first time that you were born. You will remember that you were the one who was crying and everybody around you were rejoicing. When we live our life so well, the table will turn. We'll find ourselves rejoicing as we go to the grave and everyone around us crying. That's a life of contribution. And it is important that we find what life that we can impact. With that said, I want to, knowing fully well that I have very limited time, I want to say that the time has come. And now, when nations and institutions must factor inclusivity in their development agenda, it is no longer it has now become a right issue that the vulnerable must be factored in every space. No longer the days of going to cap in hand to beg for charity. It's now becoming a right of persons with disability to be included in every space. It's no longer the fashion for us to, for people around us to ask us to please vote them. Now we're turning the table around and saying, we too want to be for. In my remaining time, I would like to intervene in specific 4 areas. Number 1, I'll talk about the challenges. Number 2, I'll talk about the opportunities that the challenges has thrown out. And then I'll make some recommendation and I'll come with conclusion. The pandemic has been a devastating issue, but that's also the flip side of it, where it presents an opportunity that people never saw. Here in Nigeria, when we launched Disability Inclusion Nigeria, we wanted to ensure that every space, and when I mean every space, political, social, every space must accommodate the principles of inclusion. And we go to any length and every length to ensure that that happens. So the challenges, the pandemic. First, let me talk about access to political space. The challenge here has always been that the most vulnerable are not carried along, be it in voting rights, in ensuring that they participate in the electoral process, ensuring that they contest for elective offices, ensuring that whatever guideline political parties have, accommodate them. And of course, with what is happening today, INEC in Nigeria, INEC is the electoral body in Nigeria, have come out with a policy and a guideline. Looking at those policies, the rights of the most vulnerable are not totally holistically factored in. There are some principles that they want to adhere to during the forthcoming off-cycle election that will impact persons with disability in general negatively. They're asking for compulsory face masks, which is a good thing. Every disease control across the world is insisting on that. But little is known in the fact that there are some of us, especially the rural dwellers, who cannot afford the face mask. How are you going to accommodate them? Well, that's just the political space. Let's look at the educational space, the education space. Right now, I have a little son who is at home, and because he's in a private school, he's able to participate in his classes through online. And that's for me. And because I have the little privilege of being able to put him in a private school, the public school are literally not doing anything. And if they are doing anything, the most vulnerable don't have the resources, don't have the technological know-how to participate in continuous education. In our movement, we are challenging the government, challenging the status quo by creating an education conference. By next week, we're engaging the entire nation and the world to rethink education. How do we continue learning? How do we engage the teachers? Most of the teachers, 80% of them, don't have technological know-how. How do we continue to engage them? And so we're holding the government accountable and making them rethink the process of not just education, but learning. Health space is another challenge. The persons with disability that have been with underlying illnesses, who consistently look out for not only caregivers, but doctors to take care of them. Of course, during the lockdown, they were locked out. And for persons with albinism, which is my immediate community, during this pandemic, we have buried well over 4 people. 4 people. And so it's a challenge gaining access not only to the health space, but quality health space. Financial space. Again, we have a challenge here that we're talking about social protection in the country, sending money to the most vulnerable. The politicians hijacked the opportunity. Instead of sending this money to the people who needs it, they are, and then of course, that's the high level corruption has impeded what would have been a very valuable project. Human rights, the rights of persons with disability at all fronts have been violated. Their rights to education, their right to health, their right to social life has been totally and absolutely hindered. Social services, the social services that government would have provided had been an issue. I just mentioned the social protection program. In the first place, persons with disability were not even carried along in the policy that established the social protection program. And so how can you advocate or intervene for people you don't know what their needs are? And that's a major problem. With this little time that I have, I think I want to make some few recommendations. Number one, this conference should think of a program and most effective ways to engage persons with disability community. Persons with disability community needs to be properly engaged in every social development framework. Their absence on the table have been responsible for most of the abuse that they have suffered and the ignorance of policymakers and implementers in carrying them along. Number two, we need a strategic advocacy for inclusion of PWD in public and private sector. We need strategic advocacy, measurable, tangible advocacy. I know my time up.
Yeah. Yeah, just 1 minute more, Mr. Jake. No problem, 1 minute more.
Okay, let's also look at policy and legislation. What can we recommend that will influence policy and legislation? And finally, because I will not want to abuse my time, it's important for us to rethink the education of the most vulnerable. Education of the most vulnerable is a right, is not a charity model approach to solving their problem. Remember that you can make life with what you get, but remember that you can make a living with what you get, but you make life with what you give. Let us see how we can create an inclusive society where all, in spite of their color, creed, and gender, will thrive and live out their potentials. Thank you so much. God bless.
Thank you, Mr. Jake. I think we'll take the questions in the end, and I will move to the next panelist who was there, with us. We have with us Miss Amanda Rehnquist. I'll request her to come and share her experience with us. Before that, I just want to introduce her. She is the Bertha Justice Fellow, and and works in the area of human rights. She is part of the movement of the human rights movement, lawyers movement in pursuit of social justice, and represents the Equal Education Law Center in South Africa. Thank you, Ms. Amanda, for coming in and speaking on this panel. Thank you.
Thank you so much for having me. And just one small add-on. I've now moved on from Equal Education and now work for an organization called Black Sash, who specifically monitors social assistance and social security in South Africa.
Thank you so much. That's really nice. Thank you.
Okay, so I want to just briefly talk about four key things that have come out of COVID in South Africa. One is to give just a brief overview of what has happened in South Africa, what existed before COVID-19 and how that's been exacerbated, how Social Security has failed before and how it continues to fail, the issue of access in South Africa, and more importantly, the issue of rethinking of how we see the poor and the vulnerable in South Africa. So just to give you a bit of a context into South Africa before COVID-19, South Africa is one of the highest inequality rates in the world, with an unemployment rate of 39% using the broad definition. There's very little regulation and protection for those in the informal economy. Very little trade union protections are given, if any, to those in the informal economy. 18 million out of 60 million South Africans receive social assistance from the government. 10 million more do not receive any social assistance but have no form of income. So that's what we call them in South Africa, the missing 18 to 59-year-old. Those who don't get child support grants and don't get old age pensions, and so do not and have no form of assistance. And South Africa was also given junk status just before COVID-19. And so prior to the pandemic, there were already many economic factors that already skewed the rights of those who were most poor and vulnerable, who had limited their access to their basic services and basic needs, and we really had the most vulnerable struggling in South Africa. And so as you can imagine, all of these things were exacerbated and just made so much worse when COVID happened and a lockdown had to happen. People were forced out of their jobs. People were retrenched. People couldn't create any income for themselves because they were part of the informal economy. And so, given all of this, there was a need for some serious social security interventions. These social security interventions only happened 3 weeks after we had a full lockdown, a lockdown in which no one was allowed to leave their homes, no one was allowed, only essential services were allowed to operate. So only 3 weeks after people were left and hunger became an absolute crisis, did the government begin to put in proper measures for social security. Before this, like I said earlier on, we had 18 million South Africans receiving social assistance. So that's the child support grant, a disability grant, and old age pension. These grants, while a major inroad into protecting the most vulnerable, are in most cases a very insignificant amount. And as I think, and my colleague from Kenya had highlighted, also costs people so much money to actually access. Transport costs to go and access that money because there's insufficient use of cash transfers. Everything is by old traditional fetching the cash from the post office, which means there was no social distancing. People had to have, even before COVID-19, people have had to stand in long queues for hours, sleep over at the post office the night before. And often people would put money together to pay for transport or for a private car to take them there. And all of these things were made even more difficult by COVID-19. So social assistance in South Africa is a constitutional right. It must be progressively realized by the government for those who are unable to support themselves. But what COVID-19 highlighted was this complete missing middle. And so when we think of ways forward and how we move on, we need to think of people who don't ordinarily qualify for social assistance, but because of COVID, because of the fourth industrial revolution, because of high unemployment rates, cannot provide for themselves. And we need to begin to really think about this idea of a basic income grant, basic income cash transfers for adults, when post-COVID and during COVID. And so this is one of the key things that I want to talk about when we think of the future. But I want to talk about what's happening right now, which is an issue of access. So in South Africa, we have these social grants, but we have a major issue of access. And this is because when COVID-19 happened, the Department of Social Development, which hands out grants, registers people for grants and these cash transfers, didn't declare itself an essential service. It didn't feel like it needed to open its offices. It completely shut down for 3 weeks. And then after 3 weeks, or maybe possibly more, my dates must be correct, only 33% of it began to operate. So that means people couldn't register for new grants. If they didn't have a cell phone or an email address to send, they couldn't do this online. They had to go to the offices. And so there was all these access issues in terms of getting any sort of social assistance, because the Department of Social Assistance doesn't see itself, and the government didn't see itself as an essential service. And that's the question we need to begin to think about, is that this is not just one department by the government. This is not some random service. This is people's livelihoods. And when we think about the future, we think about COVID and we think about post-COVID, we need to think about how important we view the issue of social services and social security and social assistance to people. 3 weeks after the lockdown, government announced a 350 Rand, which equates to about $20, grant that was going to be given to people who found themselves without jobs, without employment, who weren't receiving unemployment insurance because they were within the informal sector. And this 350 Rand is completely insufficient, but not only is it insufficient, it is incredibly difficult to access. And here again is the issue of access. And particularly for those who live in rural communities. Those who live in rural communities who do not have access to information there's had to be so much NGO and community-based organization intervention at the moment to make sure that those who are in rural communities get access to this grant, or at least access to applying for the grant, because even that, you need a smartphone, you need internet access possibly to register. But even when you are able to register, there are so many other barriers, such as your address, your ID number, your bank account. Even though the unemployment insurance, the Department of Labor has a list of all those who are unemployed, the state keeps putting more and more barriers into accessing social services. And so, Chair, I'm not sure how much more time I have left, but I want
1 minute. 1 minute.
Okay, that's good. Well, good. Well, I want us to think about what Arundhati Roy said when she said, not only is a new world possible, but it's on its way. And we need to begin to think of this new world and how we think of the poor, how we think of the vulnerable, and how we think of assisting them. They need to be at the forefront of our mind when we think, okay, there's going to need to be a 21-day lockdown. Firstly, what are we going to do to protect those who are without income? That must be the first question. Unlike in South Africa, it cannot come 3 weeks later. And then after those 3 weeks, because we are on day 76 of lockdown in South Africa, all of the other inroads we've made to protect have not come from the state. So we've expanded unemployment insurance because there was pressure from outside of government. We've expanded child support grants because there was access from outside. There was pressure from outside of government, and we need to have a government that thinks pro-poor, and that needs to be our fight post-COVID. Thank you.
Thank you so much. Thank you. Thank you, Deva, really. I'd now like to request Professor Shailesh Darokar from Tata Institute of Social Sciences to come on the panel and speak his experience. Professor Darokar has worked extensively in the space of social exclusion and inclusion, and particularly his focus has been on the urban landscape and looking at vulnerabilities in the urban space. I'm very happy to welcome Professor Darokar to speak here, to speak before us. You have 7 minutes before you. Thank you. You need to unmute yourself. No, we can't hear you. You need to unmute, I think. Yes, we can hear you now. I think, no, we can't hear you.
Dr. Darokar, can you just push in the audio into the computer? Maybe that's loose.
Yes.
I think that's better.
That's better.
Yeah. It's better?
Yeah, little.
Okay.
Thank you.
In case any problem comes, please let me know.
No, we can hear you now. Thank you.
Yeah. Okay. At the outset, let me thank the organizers, particularly the Appropriation Association for Justice Development and its program director, Professor Renuka Dagar, and Professor Madhushri for giving me this opportunity to talk some of the issues on such a global kind of a platform, and with a very enriching kind of a panel over here. Now, as far as talking about India is concerned, actually, it's a very, I would like to start with the kind of inherent complexities that this society has. You know, I mean, to talk about Indian society is not easy because it's a product of a very long and complex historical process, you know, and there to talk about certain kind of these issues often becomes very difficult and also a very long kind of a process. Now, if we talk about the very formation of this society, you know, as we know that actually, you know, it's a very long and complex process. As I said, we often talk about the Aryans arrival in the Indian society, the Vedic religion's formation in Indian soil, and the very emergence of the protest religion in response to the Vedic religion called the Hinduism, and then you have Jainism as a protest and protest kind of religion, and Buddhism, and also Sikhism. So this is one. Then we have basically the also the arrival of the Christianity and Islam, and then we have waves of colonialism. Okay, with this, then we get a very complex kind of structure getting being put together. Now, at present, if we think about this Indian society, we have nearly 1,500 speech communities in this country, more than 680 tribal communities in this country, near about 4,500 to 5,000 backward communities, excluding scheduled castes and scheduled tribes. So if we take only the backward class communities and scheduled castes and scheduled tribes, they themselves become almost 75 to 80% of the Indian society. So this is very complex. And now, coming to the main point, the Indian economy is an informal economy. The informal sector is almost 92%. So literally we have only 8% formal or government, or what we say corporate sector. Now in this informal sector, whenever we talk about informal sector, we know that the issues that have been raised by the earlier panelists, like the social security and other kind of issues that we are talking about. And when pandemic like Corona or COVID-19 hits, what probably issue that we might actually discuss around. Now, given this kind of thing, I would rather like to talk about the urban context, and also give us one or two examples of the rural context to what is happening post or during the COVID period, to this very complex kind of Indian society. To begin with, I would like to say that actually the most affected people by COVID-19 pandemic are these 80% that I am talking about, who are in informal sector. One. Second, the COVID has come to India via passport, and the heavy price is being paid by the ration card. The ration card is basically the entitlement document for redistributive system. And this 80% overwhelmingly also are dependent on the ration card. So when the Corona came, it came via passport, but the heaviest price is being paid by the ration card holders. How? Now, as we know that actually whenever we look at the Indian realities, only 4 regional centers that if you see, and 4 regional cities that if you see, Bombay, Delhi, Chennai, Kolkata, Bangalore, Pune, all these cities are the main cities where all the migrants from the villages have come for their survival. Because obviously they do not have, they are either marginal farmers or they are landless laborers. That is the reason that they have to migrate to the cities. Where do they land up in the cities? Of course, they land up in the informal sectors. But that is not the thing. You must have heard the name in all these days now about Dharavi. Dharavi is a huge slum settlement in Mumbai city, which has 1 million population. Now this 1 million population is accommodated in a space of 2.1 square kilometer. So if one looks at the density, it comes to 3.5 lakh people being accommodated in 1.5 one square kilometer space. Now, what happens to the so there is no need to obviously talk about the kind of living conditions that one can come across in this slum settlement. There are no access to safe drinking water, very poor sanitation, living condition is worse. And in that kind of a situation, we are talking about social distancing, quarantine, isolation. There are so narrow gullies, the narrow spaces. People, these settlements are all crowded. 10, 15 people are being accommodated in small, tiny house. So now in this kind of a situation, what happens to the concept like social distancing and other things? I would also like to problematize this very conception of social distancing. Now, in India, there is already a social distancing in place. The caste, class, gender is already is all about social distancing. So it has to be a physical distancing. But the city like Mumbai is already segregated on this line. The city is already segregated. Now, when we talk about this segregation, these disparities, I think the COVID-19 like pandemic actually worsened the situation of the urban poor, because they could have been allowed to go before the lockdown was announced, but they were allowed to go only after 2 or 3 lockdowns were already over. So now their situation has become worsened. Another most important point that I would like to make is that the elites would like always to have the services from this kind of population, because these are the people who are building the cities. Mumbai city alone contributes to 40% of the GDP of the whole nation. But when it comes to their entitlement to housing and other fundamental rights, because although all these complexities that we are talking about in Indian society, in 1950, the Constitution of India was framed around what is called the fundamental rights of the citizens. Now, what happens to these fundamental rights of the citizens? In COVID, all this gutter, all this garbage has come onto the surface. Now, when these people began going to their villages, of course, these are marginal farmers, or they were the landless laborers, and they were also the backward communities. They obviously had a lot of clashes with their masters in the villages. We had Jajmani system in olden days. We had client-master relationship in villages. Now, when these people go back to the villages, what happens to their, how do they actually probably assert to the common property resources? There are number of cases now are coming, the people or NGO people with whom I am in touch with, there are a lot of atrocity cases now, because the urban poor have gone back to the villages and probably they are now searching for the common property resources for their survival. So these are very prominent kind of issues that we are talking about. Now, one last, in case I have time, Professor Madhushri.
1 minute.
Yeah, 1 minute. So even in urban context, the sanitation workers. Now we are talking about all the groups like the health professionals, health workers, police, and everybody. Now, why these people become vulnerable? Mainly because 90% of these people come from a particular community. This particular community is already historically been marginalized. So one has to also take into consideration all these things, and end of the day, these people do not have any hope except looking up to the state, and how state is actually trying to strategize and meet their issues everyone knows actually what is happening to people have, I mean, gone on their foot 300, 400 kilometers to reach their home states. So situation is worse. And in this kind of a situation, the local resources which should in a way come forward are not in very much visible because of the kind of disparities and social inequalities that we already have in Indian context. The crisis will worsen and the vulnerable will become far more vulnerable in the days to come. I think I can stop here, and
Thank
maybe
you
some
so
questions
much.
can
Thank
be
you,
taken.
Dr. Somas, Professor Daruka. Thank you very much. Now I have the pleasure to invite Professor John Walia to speak to us and share his experience. Professor John Walia is the director, Dag Hammarskjöld Institute for Peace and Conflict Studies, Copperwelt University in Zambia. He is a human geographer and with research interests in understanding social movements and studying conflict, particularly inequalities and conflict. Welcome, Professor John, to this panel. You have 7 minutes before you.
Thank you very much for the invitation, and I wish to appreciate this forum and the interaction that is so enriching. I've listened to very brilliant presentations, and some of those, it's like you've been reading our script here in Zambia. I listened to Ghetto By from Kenya. It's the same story as in Zambia. I listened to Amanda in South Africa. It's a similar story. So our situation in Zambia has not been too far removed from what the rest of the countries in Africa are experiencing. But let me just share a few perspectives that are within the context of Zambia. One of the things that we need to appreciate and understand is that when we talk about vulnerables, the COVID-19 has demonstrated that there are actually new vulnerables. In the traditional sense of understanding the vulnerables has been stretched, it has been expanded. And then those that were already considered as vulnerable communities or vulnerable groups of people, the level of vulnerability has been accentuated. So there is a stretching or expansion of vulnerability and also deepening of vulnerability. Now, in the context of Zambia, we appreciate the depth of vulnerability which COVID-19 brought. When we look at the context, what has been the context? 2017 and 2018, we had severe droughts, especially 2018 was a very severe drought in most of sub-Saharan Africa, especially Southern Africa, where Zambia is. Then, so the people were contending with the issue of bread and butter food. And the government had put in place mechanisms to try and basically distribute the staple food to many vulnerable communities, especially the rural communities, and some of the urban communities in poor residential areas. Now came 2019. 2019, we had the excessive rainfall, so there were floods. And some of the floods we've never seen in the living memories, and because you found certain houses in rural areas actually being submerged. Whole communities had to be relocated, moved to higher ground, and their fields were destroyed. So new vulnerability for food. And we also had the 2 years of drought influenced our power generation. Most of our power is coming from hydroelectricity. And so that affected the capacity of the utility company to provide the needed electricity. So what did the utility do? They had to do power outages, rationing. So you had in some cases electricity outages for maybe 12 hours, 10 hours, 8 hours. As at now, we still have 8 hours, even though there has been some good rains, but our dams have not been full. So now what did that do? The reduction in power generation meant that a number of small businesses especially had to close down. The income generation from those businesses have gone down. Some have had to lay off some workers. Now, in the mix of that, Zambia depends on mining a great deal. It's a significant, it's the largest economic activity in Zambia. But mining has not been doing too well. Some have been closed. There was the threat of closing and also retrenchment in some. Now, when you put all those things together, COVID-19 came. Now, so that's where it begins to expand the level of vulnerability, because again, COVID-19 meant that a number of activities had to come to a standstill. About 90% of the Zambian workforce is in the informal sector. And so the informal sector has been tremendously affected because people have to stay at home. The buying power of the people has also gone down. So there's this ripple effect. And when I talked about the mining challenges, mine activities have these forward and backward linkages. And in the forward linkages, there is a new vulnerability. In the backward linkage, there are also new vulnerabilities and extended vulnerabilities. So, what has COVID-19 done in terms of vulnerability? I've talked about the informal sector being affected. I've talked about the spending going down, but we've also had layoffs. Some of the small businesses that we had a very big knock were places like restaurants, barber shops, some bars, some gyms, and with the closure of most of the international travel, the tourism industry literally collapsed. In our big city of tourism is Livingstone, and you find it's a quiet city at the moment. So the capacity to earn for many people has gone down. And when you talk about human rights, actually, that is a very important element in the right to work has been compromised. So we've seen unemployment increase, and with that increase in unemployment, increases the vulnerability. People who are not vulnerable have become vulnerable. Education has been disrupted. Same story as Getabai mentioned in Kenya. Schools have been closed. They are just now being opened. But schools were closed, and in terms of vulnerability, we have about 97,000 children who feed in schools. That's one of the social security measures government has put in. So they go to school and they feed there. But with the closure of the schools, those 97,000 plus people could not go to eat. So there's a threat to their very livelihood. In fact, the president really put it very well in his fifth address to the nation. He said the country had a choice between life and livelihood. So either you could actually die staying at home, or you could find something. So now, when you look at the human rights also, it is important to mention that the concept of human rights, at least from the Vienna Declaration point of view, the human rights are interdependent and they're interrelated. So the moment one right goes down, it affects many others. So when you talk about reduction in employment, reduction in food, there are many other rights that are also violated or threatened. Let me give you an example. We've had cases because of the fear of COVID-19, where some of the employers, because they don't want to let their employees go home after work, they keep them locked in containers and some places where they are really squeezed. And it's a violation of human rights. The right to freedom of movement, freedom of having relations with family were compromised. So all that has been because of the COVID-19. So in terms of rights, we have seen a different, unexperienced before cases of rights violation. We can extend that rights violation in the political arena because of social distancing or physical distancing. It is very difficult to organize political rallies. We are going to be having elections next year. Under normal circumstances, this year would have been, there's a hive of activity in that regard. But that has been compromised because of the fear of COVID-19. But it is important also to note that even though COVID-19 has presented a number of challenges in terms of human rights, respect for human rights, in terms of basic livelihood for the many vulnerable groups, it's also presented an opportunity for resetting. It's as if there's an opportunity to press a reset button, to do things in a new way, in a different way. For instance, one of the good things that has come out of this COVID-19 is the level of multi-sectoral approach in resolving vulnerability issues and help. For example, we've had many organizations and individuals who have made tremendous contributions to help with food, with supplies that are needed for people working in the forefront of COVID-19 prevention, and also those that are vulnerable, who are actually a carryover from the drought and from the flooding. So the different sectors and different organizations, whether non-governmental organizations, multilateral institutions, they've come in to provide a hand. So therefore, if we're looking at how do we proceed in terms of dealing with vulnerable groups, this COVID-19 has demonstrated that the dependence only on government to resolve vulnerability are very limited. It is important to look beyond, outside the box of depending on institutions that are state institutions and looking at community organizations, looking at multilateral organizations and non-governmental organizations. And that's what we have experienced in Zambia. I should also maybe add one thing. The closure, how long?
1 minute. One minute.
Okay, I'll end with this one. Same as Getai, you know, when we had the closure of schools, learning, suddenly there's been so much emphasis on online learning. Children who are in rural areas don't have access to television. Of course, in some instances, we have television programs, education programs. Those who are in rural areas, those who don't have access to television, don't have access to phones and computers, are completely left out. So their right to education is being compromised. So in a nutshell, that's what we have experienced in Zambia.
Thank you very much, Professor Walia. Thank you so much. We have the 5 panelists who have spoken to us. We have certain questions here which are already on the chat box, which I can see. Renuka, should I read them out, or I'll ask the...
Madhu, I think you can just collate them and maybe put them across to everybody, and whoever wants to answer.
Okay, I have questions that ask about, have the relief measures like cash transfers that are being put out followed by long-term sustainability plans? What policies could be helpful to ensure sustainability of the interventions that look at building economic, addressing the economic needs of these vulnerable populations? Then we also have a question that looks at, that asks about the most vulnerable are not always carried along, and there's the issues of voting rights and political. This is more a comment that is put out. So there is need for promoting the inclusion and participation of these people. And there's also a comment which talks about creating more holistic approaches to help promote inclusion and participation, particularly for the PWDs, and how this can be done. So these are some issues that are there that have been raised on the platform that was put out. If there are nothing more, I would like to round up, or is there a possibility for me to round it up? So
Please do.
Yeah, so I would like to take this opportunity to thank all the panelists who raised very, very important points when we are talking about this whole understanding of into the what we were trying to do is understand inclusive development and rights and challenges, particularly looking at the challenges and the opportunities thrown up by the COVID before us. Some of the important takeaways that I could list, please forgive me if I missed out anything, that I would take away from this discussion were, number one is we look at the context. Vulnerability and processes for capturing inclusive or planning inclusive development cannot exist without looking at the context. Context could be what the communities are living and experiencing, but also the experiences of other pandemic, other problems like floods, rainfall, all these also contribute and multiply the multiplicity that are experienced during this pandemic. So context becomes the first issue that we need to take measure. Then when we look at the measures for addressing concerns or strategies for building strategies for inclusive development, it is also important to look at the different costs that these measures involve. The costs could be not only in terms of the costs that come in terms of the impact that these processes have, but also the transaction costs that come along. The transaction costs of reaching out, taking transport, addressing job losses which are more informal, and all this. So it involves a lot of balancing act, both in terms of the providers and those who receive the service, because there are costs that need to be looked into while talking about inclusivity. Vulnerability is not just a question that we look at vulnerability per se. Vulnerability has to be recognized today in the right, as a right itself. Vulnerable, if you are vulnerable, you're not asking for anything that you're not begging. It's a right that you ask for being included in development. So that's a very important takeaway. That so every space, whether it is political, social, economy, must accommodate the processes of inclusion, whether they are processes that are planned and strategized through state and government interventions, processes that are recognized and provided through the industry and the businesses that are there, which are looking at and providing employment, working with them, and also processes that come within from the community itself. That means we look at all types of, so dependence not only on government, but dependence should be beyond the government and look at outside the box, look at the community and other players who could come into this. There is one important factor that needs to be recognized is that any intervention or any inclusive development that we look at strategies for looking cannot exist without taking into consideration the timing of the issues. What and when are the strategies being planned for inclusion? If you plan for an inclusive process, if you plan for social securities which are taking place as an afterthought after 3 weeks of a lockdown, it does not meet the purpose for which it was being planned. So development has to be a continuous process. You cannot have a pandemic just making you respond to it. It has to become a right. It has to be recognized within the constitutional frame, and systems and strategies and institutions need to plan for it and look and ensure that these take place properly. There is, while looking at the vulnerable population, we also need to recognize that vulnerability is not something that is status quo. There are changing, it's a fluid population. Those who were vulnerable today continue to be, but there is, in a pandemic, there could be others who are not vulnerable could become vulnerable. So that is very important, that there's a huge missing population sometimes who need to be recognized, that this vulnerability has to recognize the people who do not ordinarily qualify for a social security intervention can also become vulnerable. So that's why we need to recognize that we don't have hard structured approaches for creating inclusive processes can fail to meet the purpose for which it was being done. So you need to have a more fluid systems which recognize the possibilities of somebody becoming vulnerable at different points. And most importantly, that was still told out, is while recognizing vulnerability and planning for inclusive development, we need to map the complexities in the society itself, the complexities that are there in the societies itself, to recognize that these complexities can become that. How do we talk about development or inclusion when the complex of the social structures do not allow for a particular intervention? So your response should be recognizing and understanding this complex. I would like to end by saying that the face of vulnerability and vulnerable and inequality is not the same across our country, is the same across all our countries. We are all brothers and sisters in this pandemic. Let us all work together. Thank you.
Thank you, Madhushri. That was an excellent synopsis. You've put in all the points together and handled everything so well. Thank you so much. I think one of the points that comes out, so much food for thought and so many things to chew on. One of the things that came up very strongly to me was the issue of categories. The kind of categories which we've been using, these need to be evolved. They're so static and they're so segmented, and it's taken a pandemic to show that these are not relevant. What is called essential services is it's not just the police or the hospitals which are essential services. Welfare provisioning becomes essential when people are dying of food, are starving. Similarly, you have courts and all need to be seen as essential services when you have a human rights pandemic. So how do you make sure that these categories don't remain static when reality itself, actually every day it's changing, but it's taken a pandemic to show us that the reality is actually much more dynamic, and we need to have a categories of analysis and concept in conjunct with that. And I think got a lot of positive things that have come out. For instance, the idea of community. It's not the government or the state structures. We on the social development sector have been talking for so long that the communities who have been managing and governing themselves for centuries have so many practices and mechanisms which are built into and honed down from generations of experience, and we need to include those. So that's why we need to have a multi-sectoral, a multi-dimension compilation and approach, which has not been looked into. And the second thing which I think COVID has done, the pandemic has done, the two categories or separations of, let's say, the universal rights and the specific needs of the people on the margins or the poor have become merged, because you find that people who are not vulnerable have now become vulnerable. Or you say the governments were always looking into providing opportunities, and now we find that the opportunities itself are being constrained. So you don't have the opportunity even to go out and earn a living. Yep. So these issues of the particular rights and the universal rights, which need to be looked together in a holistic manner, are now we're being forced to do that. So thank you all for an excellent panel and excellent discussions. I just wanted to inform all of you that now we'll be moving from the weekly webinars to a monthly webinar. So we would want you all to join in with as panelists, because all of you are so experienced, and to join in the discussions. We'll keep you informed for that, and thank you all again.
Thank you all. Thank you all. Thank you. Thank you.
Thank you so much. Thanks a lot.
Thank you.
Thank you so much. Thank you.
Thank you very much.